that came out in the Philadelphia Inquirer August 21st, 2018. Fentanyl is killing more and more people in Pennsylvania. This is one of those states that has been hit exceptionally hard. If you remember, in December of 2017, the governor declared a state of an emergency because so many people were packing into the morgues from overdose deaths, and it didn't matter if it was the city, the suburbs, or the rural area. The whole state is really bad. Just as it is in Philadelphia, the synthetic opioid fentanyl is driving the overdose crisis throughout Pennsylvania. New data from the Drug Enforcement Administration show. Fentanyl was present in 67% of the state's 56 overdose deaths in 2017, up from 52% of overdoses in 2016. 4,642 people died. In 2015, overdose deaths across the state have risen by 64%, the DEA said. But the rate that increased slow last year from 2015 to 2016. Deaths rose by 38%. From 2016 to 2017, deaths rose by 18%. In Philadelphia, which has the worst opioid death rate of any major city in the country, 1,217 people died of a drug overdose in 2017, about 22% of the state's total overdose deaths. Fentanyl was present in 84% of those cases. Thomas Farley, Philadelphia Health Commissioner, said the new state-level data suggests that Pennsylvania's opioid plague is no longer confined to urban areas. We've always had a bigger heroin problem than the rest of the state, he said. What I'm struck by is how much of a problem we have in the rural areas that were previously untouched by this. The opioid plague is raging through Pennsylvania like the wildfires are raging through California. He said the rise in fentanyl-related overdoses was particularly concerning. Trust me, ladies and gentlemen, fentanyl is high in the rural areas in Pennsylvania. You know what they do? They micromanage the urban areas, and they don't even think about looking at the rural areas. It's always been in the rural areas, but they don't micromanage them like they do the city. And that's really what it's all about. That's the top drug here. It's 50 times as potent as heroin, much more likely to get people addicted, much more likely to cause an overdose, he said. It's changed the entire nature of the problem. The DEA will issue a more detailed report on the state's overdose death rate this month, but it released these preliminary numbers as the Center for Disease Control and Prevention released its own provisional data on the overdose plague nationwide. Predicting data will show 71,568 overdose deaths between January 2017 and January 2018, which they're lowballing the numbers. It's only 22 states reporting to the CDC. It's difficult to say what's driving the national spike in overdoses, up from 64,000 overdose deaths in 2016, because county coroners often don't report the types of drugs that killed overdose victims on death certificates, which is the only way for the CDC to track such information, said Bob Anderson, chief of the Mortality Statistic Branch at the CDC's National Center for Health Statistics. Still, he said, the increases since 2016 were alarming, although some states in the West and New England reported declines in overdose deaths. The fact that we are seeing some decline in some states is certainly encouraging, Anderson said, but the numbers continue to rise in several of the other areas. I'm hopeful that what we're seeing here in the most recent months is kind of a peak in the problem for the nation. And we'll start to see some declines here. But it's impossible to know for sure until we get some more data. It could be just a small stall, then start going up again. Farley said the statewide data shows. So what he's pretty much saying is right now in the cities and towns across Pennsylvania, they're not seeing much of a decline at this time. And, you know, Pennsylvania is one of these states. I would not be surprised if it's one of the top states that have the most opioid deaths. You know, a lot more deaths occur there than even here in the state of New Jersey. Not every small town and every city in Pennsylvania need to do all the steps that are important. Reduce overprescribing of opioids, make drug treatment available, and distribute naloxone, the overdose reversing drug, he said. Now, Pennsylvania, the one thing that makes it unique, in the city area, actually the Latinos have the highest opioid death rates. But when you get to like the rural areas and the suburbs, it's usually more of the non-Hispanic whites. But nevertheless, Pennsylvania is a very troubled state when it comes down to drug addiction. They've always been in this state now for several years. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.